There is a detail buried inside the forensic record of June 25, 2009, that most people have encountered only through rumor and speculation. A detail that has been passed from forum to forum and documentary to documentary for 15 years, gathering layers of mythology that have almost completely obscured the medical reality underneath. Michael Jackson's eyes were reportedly open when he was found. For 15 years, that detail has done enormous work in the imagination of the people who encountered it. It has been treated as a clue, as evidence of something hidden, as the kind of specific and haunting observation that demands an explanation beyond what the official record provides. But here is what almost no coverage of this detail has ever done. Ask a forensic pathologist about it. Because when you do, the answer that comes back is not mysterious. It is not conspiratorial. It is not the kind of answer that generates 15 years of forum discussion. It is the kind of answer that makes you realize how completely the mythology around this detail has divorced itself from the medical science that actually explains it. The orbicularis oculi, primary flaccidity, propofol's specific effects on facial muscle tone, lagophthalmos. These are not obscure terms invented to explain an anomaly. They are standard entries in the forensic medicine literature that describe a phenomenon that pathologists and embalmers deal with routinely. Today, we are going into that literature. We are going into the forensic record. We are going into the specific physiology of what propofol does to the human body and what cardiac arrest does immediately after. And we're going to find out what the science actually says about why the eyes may have been open and what it actually means. The answer will not give you the mystery you may have been looking for. It will give you something more useful, the truth. Begin where the evidence begins. The official autopsy report completed by the Los Angeles County Department of Coroner following Michael Jackson's death on June 25, 2009. This document is the foundational evidentiary record of what happened to his body. It was produced by trained forensic pathologists whose job is not to tell a compelling story. It is to document what the physical examination of a body reveals with clinical precision. The autopsy report confirms the cause of death as acute propofol intoxication with benzodiazepine effect. It documents the toxicology findings. It records the physical condition of his body at the time of examination. What it does not contain, and this is critically important, is a specific and formally documented finding about whether his eyes were open or closed at the scene or at the time of the examination. The absence of a specific documented finding on this point is itself information. Forensic pathologists document what they observe. If open eyes had been a notable or unusual forensic finding in this case, it would likely appear in the record. Its absence from the formal autopsy documentation means that whatever the state of his eyes at various points in the sequence of events following his cardiac arrest, it was not treated by the examining physicians as a finding requiring specific forensic notation. This tells us something immediately. It tells us that whatever the state of his eyes was, it was within the range of what forensic examiners encounter regularly enough not to require specific documentation as an anomalous finding. To understand why that matters, you need to understand what actually happens to the eyes after death. And to understand that, you need to understand the specific anatomy of the eyelid and the mechanisms that normally keep it closed. The eyelid is not simply a flap of skin. It is a precisely engineered structure. The orbicularis oculi is the circular muscle that surrounds the eye and controls the closure of the eyelid. The name comes from the Latin for circle and eye. When this muscle contracts, it closes the eyelid. When it relaxes, the eyelid may partially open depending on the other structures and forces involved. In life, the orbicularis oculi is in a state of continuous low-level activity. Even when we sleep, this muscle maintains enough tone to keep the eyelids gently closed. The sensation of heavy eyelids when tired is the experience of this muscle losing its ability to maintain that tone against the weight of the eyelid itself. Sleep eventually wins. The muscle relaxes enough to allow the eyelid to close completely. Death changes everything about this system in ways that are medically predictable and well documented. In the immediate period following cardiac arrest, the brain stops sending electrical signals to the muscles throughout the body. This produces the state called primary flaccidity. Every muscle in the body simultaneously loses its tone. The muscles do not contract, they do not resist, they simply release whatever tension they were maintaining. For most muscles in the body, the consequence of primary flaccidity is that they relax and the body assumes a posture determined by gravity and the position it occupies. For the orbicularis oculi, the consequence is that the muscle responsible for keeping the eyelid closed releases its tone. And when that muscle releases, the eyelid does not necessarily fall closed. It may drift partially open. This is the phenomenon called lagophthalmos. The word comes from Greek, meaning hare eye, a reference to the ancient observation that hares appeared to sleep with their eyes open. In the medical context, lagophthalmos describes the incomplete closure of the eyelid. It can occur in living people as a result of nerve damage or muscle dysfunction, and it occurs predictably in many people at the moment of death because of primary flaccidity. The degree to which the eyes open during primary flaccidity varies considerably between individuals. It depends on the anatomy of the eyelid, the amount of tissue volume in and around the orbital area, the position of the head and body, the specific sequence of events leading to death. For some people, the eyes remain essentially closed after death. For others, they open partially or significantly. This is not a rare or unusual outcome. Studies of postmortem eye state have found that a significant proportion of bodies examined in forensic contexts show some degree of legophthalmos. The estimates vary across different studies and different populations, but figures in the range of 30 to 50% or higher have been reported. Open eyes after death are common enough that forensic examiners and embalmers routinely address them as a standard part of their work. The embalming process specifically includes procedures for ensuring that the eyelids are positioned appropriately for viewing, because open eyes are common enough after death that it would be a significant practical problem if they were not. Mortuary professionals use techniques including adhesives and shaped caps placed beneath the eyelid to achieve and maintain closure, specifically because the natural tendency of the eyelid after death does not reliably produce the closed appearance that is culturally expected for viewing. Now bring this understanding to the specific circumstances of Michael Jackson's death, not to speculate, but to apply the established physiology to the documented facts. Michael Jackson experienced cardiac arrest as a result of acute propofol intoxication with the contributing effects of benzodiazepines. The cardiac arrest produced cessation of brain activity, and with it, the cessation of all muscle tone throughout the body. Primary flaccidity would have followed within seconds to minutes of the cardiac arrest. The propofol dimension of this requires specific attention because it is where the most specific and most frequent speculation has been directed. Did propofol cause his eyes to remain open? The question sounds specific and answerable. The actual answer is more nuanced. Propofol is a general anesthetic. Its primary mechanism of action involves enhancing the activity of GABA receptors in the brain, producing a rapid and profound suppression of central nervous system activity. When administered appropriately in a clinical setting, it produces a smooth induction of anesthesia, during which the patient typically shows muscle relaxation throughout the body, including the muscles of the face. During propofol-induced anesthesia, the orbicularis oculi typically relaxes. This is why anesthesiologists routinely tape patients' eyelids closed during surgical procedures when propofol or other anesthetic agents are being used. The muscle relaxation produced by anesthesia means the eyelids will not spontaneously remain closed without assistance, and an open eye in a patient under anesthesia is subject to drying and potential corneal damage during a procedure. This is a documented and well-established clinical reality. During propofol anesthesia, eyes tend to open partially. The muscle that closes them has been relaxed by the drug. In the context of acute propofol intoxication leading to cardiac arrest, as occurred in Michael Jackson's case, the physiological sequence involves an initial period of profound sedation, during which the orbicularis oculi is relaxed by the drug's action. This is followed by cardiac arrest and the subsequent primary flaccidity of death. The muscle relaxation that the propofol was producing during sedation transitions into the primary flaccidity of death in a way that means there's no period during which increased muscle tone would be available to close the eyelids that the drug had already relaxed. Whether propofol directly caused the open eyes, or whether the open eyes resulted from the primary flaccidity that follows any cardiac arrest, is not a distinction that can be made definitively from the available evidence. What can be said is that the combination of propofol's muscle-relaxing effects during the sedation phase, followed immediately by primary flaccidity upon cardiac arrest, would be consistent with eyelid opening, and that this is not a mysterious or anomalous outcome. It is a medically predictable consequence of the specific circumstances. What happened in the time between when Michael Jackson's heart stopped and when he was found requires careful reconstruction from the available evidence, and that reconstruction matters for understanding the physical state of his body when he was discovered. The documented timeline from the Conrad Murray trial and from the investigation that preceded it establishes the following sequence. Murray administered propofol to Michael Jackson at approximately 10:40 in the morning of June 25th. Michael Jackson lost consciousness. Murray left the room. Murray made phone calls. At some point during this period, Michael Jackson's breathing stopped. His heart stopped. When Murray returned to the room and found Michael Jackson unresponsive, the evidence presented at trial suggests that a significant period of time had already passed since the cardiac arrest. The exact duration is not established with certainty from the available evidence. Murray testified to a specific sequence that was challenged during the trial. The forensic evidence, including body temperature measurements and the state of rigor mortis when paramedics arrived, provided information about the elapsed time that the prosecution used to challenge Murray's account. This elapsed time is relevant to the question of postmortem eye state, because the processes that affect the eyes after death are time-dependent. Primary flaccidity is immediate and universal. Rigor mortis develops over a period of hours. The postmortem changes to the eyes themselves, including corneal clouding and drying, develop over time and at rates that can provide forensic information about elapsed time since death. The paramedics who responded to the 911 call from the Carrollwood Drive mansion on June 25, 2009, found Michael Jackson in cardiac arrest. They initiated resuscitation efforts at the scene. He was transported to Ronald Reagan UCLA Medical Center, where resuscitation efforts continued. He was pronounced dead at 2:26 in the afternoon. The paramedics and emergency medical personnel who were present at the scene and during transport were professionals working in a high-stress emergency response situation. Their focus was on resuscitation. The state of the patient's eyes in that context would not have been a primary concern or a focus of formal documentation in the emergency response record. The forensic examination that produced the formal autopsy record came later. The clinical notes from the emergency room efforts at UCLA and from the scene assessment provide additional documentation. Across all of this documentation, there is no formally noted finding that specifically addresses the state of Michael Jackson's eyes as a forensically anomalous observation. Now we need to address the specific myths that have grown around this detail, because the mythology is substantial and has been repeated in enough context that it has taken on the character of established fact for many people who have encountered it. The first myth is that open eyes after death indicate something suspicious or violent about the manner of death. This is false. As established above, open eyes after death are medically common and are a predictable consequence of primary flaccidity following cardiac arrest, regardless of the cause of that cardiac arrest. There is no forensic basis for treating open eyes as a specific indicator of anything unusual about the cause or manner of death. Forensic pathologists with extensive experience in death investigation do not treat it as such. The second myth is that open eyes specifically indicate that the person was surprised or frightened at the moment of death. This is also false. The state of the eyes after death is determined by the anatomy of the eyelid, the muscle tone present at the moment of death, and the position of the body, not by the emotional or psychological state of the person at the moment of death. Human anatomy does not work in the way this myth requires it to work. The third myth is that the open eyes are evidence that something happened other than what the official record documents. This claim treats the open eyes as a mystery that demands explanation beyond the official account. The reality is that the open eyes are not a mystery requiring explanation beyond the medical physiology already described. They are a predictable consequence of the documented circumstances of his death and are consistent with the findings of the official forensic examination. The fourth, and perhaps most persistent myth, is that the detail of the open eyes was suppressed or hidden in the official record. As noted above, the formal autopsy report does not contain a specific documented finding about the state of his eyes. This has been interpreted by some as evidence of suppression. A more accurate interpretation is that it represents the absence of a finding that forensic examiners considered anomalous or requiring specific notation. The absence of documentation is not evidence of suppression. It is evidence of clinical normalcy. Beyond the specific myths, it is important to be precise about what is actually known, what is uncertain, and what the evidence does not support. What is confirmed by the official forensic record? Michael Jackson died of acute propofol intoxication with benzodiazepine contribution. The toxicology findings document the specific substances present in his system. The autopsy documents his physical condition at examination. Conrad Murray was tried and convicted of involuntary manslaughter in connection with his death. What is uncertain? The exact duration of time between cardiac arrest and discovery, the precise sequence of events during the period when Murray was absent from the room, the exact state of Michael Jackson's eyes at each point in the sequence of events from cardiac arrest through emergency response through the forensic examination. What the evidence does not support. Any theory that the state of his eyes indicates something other than what the documented physiology of cardiac arrest and propofol intoxication would predict. Any claim that the official forensic record was falsified or incomplete in ways designed to conceal information about his eyes specifically. The corneal changes that occur in the postmortem period provide the final piece of the physiological picture. After death, the continuous renewal of the corneal tear film that keeps the surface of the eye lubricated ceases. If the eye is open, the cornea is exposed to air and begins to dry. This produces visible changes to the corneal surface that forensic examiners can observe, and that provide information about how long the eye has been open and exposed. If the eye remains closed after death, protected by the eyelid, these drying changes are delayed or absent. The state of the cornea at the time of forensic examination therefore provides information about whether the eye was open or closed during the postmortem interval, and for how long. The fact that the autopsy report does not specifically document notable corneal changes or other postmortem eye findings as forensically significant observations is consistent with the possibility that whatever state the eyes were in, it was within the range of what examining physicians considered normal for the elapsed time and circumstances. Propofol's role in this specific physiological sequence deserves one additional dimension of examination. The drug is not only relevant because of its muscle-relaxing properties, it is relevant because of the specific manner in which it produces the unconsciousness that preceded the cardiac arrest in this case. Unlike barbiturate-induced anesthesia, which produces a relatively deep suppression of all neural activity, propofol induction is characterized by a specific sequence of stages of decreasing consciousness. During the initial stages of propofol induction, patients sometimes show specific movements or behaviors, including eye movements. As the drug deepens the unconscious state, these movements cease and the full muscle relaxation of deep anesthesia is established. In the context of an accidental overdose, the progression through these stages of deepening unconsciousness may not follow the controlled progression that clinical administration in a monitored setting produces. The respiratory depression that produces death in propofol overdose can occur at depths of sedation that are associated with full muscle relaxation, including relaxation of the orbicularis oculi. This means that at the moment when Michael Jackson's respiratory function became critically compromised, and when cardiac arrest subsequently occurred, the muscles of his eyelids were already in a state of relaxation produced by the propofol, rather than maintaining the normal low-level tone that would tend to keep the eyelids closed. The transition from drug-induced muscle relaxation to post-mortem primary flexidity in this context is physiologically seamless. The muscle goes from relaxed by pharmacological action to relaxed by cessation of neural activity. There is no intervening period of muscle tone that would tend to close the eyelids. The eyelids that were open or partially open during the propofol sedation would remain in that state through the cardiac arrest and into the post-mortem period. This is the most specific and most medically grounded explanation for why the eyes may have been open when Michael Jackson was discovered. Not a mystery, not evidence of something hidden, a predictable consequence of the specific pharmacological action of the drug that caused his death combined with the universal physiology of primary flexidity following cardiac arrest. The forensic science literature on postmortem eye state is not sensational. It is technical and precise, and it addresses the question of open eyes after death as a clinical and practical matter rather than as a mystery. Embalmers and mortuary professionals deal with the consequences of postmortem lagophthalmos as a routine part of their work. Forensic pathologists document it when it is present and move on to the findings that are forensically significant. The detail has a medical explanation, and the medical explanation is sufficient. What the 15 years of speculation about this detail actually reveals is something interesting about how human beings process the deaths of people who meant something profound to them. Michael Jackson was not simply a famous person. He was someone who had occupied a specific place in the inner lives of hundreds of millions of people across multiple generations. His music was present during moments in people's lives that become permanent parts of who they are. The loss of that person is not simply the loss of an entertainer. It is the disturbance of something that felt permanent. When something that permanent is disturbed, the mind looks for explanations that match the scale of the disturbance. A simple medical explanation, a doctor who made catastrophically negligent decisions, and a body that responded to those decisions exactly as physiology predicts it should, can feel insufficient for the scale of the loss. The mind reaches for something larger, something more mysterious, something that would make the loss feel more like a story with meaning rather than an accident with a medical cause. The open eyes have served as a focal point for that reaching. Not because they indicate anything beyond what forensic science documents about postmortem physiology, but because they feel like they should indicate something, because a detail that human experience associates with being awake, with presence, with attention, sits uncomfortably on a face that science tells us is no longer experiencing anything at all. The discomfort is human. The mythology it generates is understandable, but the mythology is not the truth. The truth is in the forensic record, in the physiology textbooks, in the clinical literature on anesthetic agents and their effects on muscle tone, and in the documented and universal biology of primary flaccidity following cardiac arrest. The truth is that open eyes after death are common, that propofol produces muscle relaxation that affects the eyelids, that primary flaccidity following cardiac arrest removes the neural signals that maintain eyelid closure, that the combination of these factors in the specific circumstances of Michael Jackson's death is consistent with eyelid opening and consistent with nothing more sinister or more mysterious than the medical events that the official forensic record documents. Michael Jackson died of acute propofol intoxication because a physician he trusted made choices in a private bedroom that deviated from the basic requirements of medical practice for that drug in ways that were ultimately judged criminal. Everything that followed, including the state of his body when it was discovered, was a consequence of that documented cause of death. He deserved a different ending. He deserved a physician who maintained the standard of care. He deserved the monitoring equipment that would have detected the respiratory depression before it became irreversible. He deserved the emergency response that would have been immediate if a trained medical professional had been present and attentive. What he got instead is documented in the official record. And what the official record reveals, when examined with the precision it deserves, is not a mystery. It is a tragedy. The distinction matters because mysteries invite speculation, and speculation can be infinite and unfounded and disrespectful to the person at its center. Tragedies invite accountability. The accountability in Michael Jackson's case was delivered through the criminal conviction of Conrad Murray. The forensic record that documents the tragedy is complete, verified, and consistent with the established medical science of how propofol and cardiac arrest affect the human body, including the eyelids. The mythology that has been built around specific details of that record, including the detail of the open eyes, is not evidence of hidden truth. It is evidence of how deeply Michael Jackson mattered to the people who loved his music, and how difficult it is for human beings to accept that the loss of someone who mattered that much was the consequence of medical negligence rather than of something larger and more meaningful. The science is not cold comfort, but it is the truth. And the truth, examined carefully and honestly, is itself a form of respect for the person whose loss generated the speculation in the first place. He was 50 years old. He made music that has not diminished. He died because someone who was supposed to protect him did not. The physiology of what his body experienced in the aftermath of that failure followed the predictable course that physiology always follows. No more mysterious than that, no less tragic. The eyes that were reportedly open when he was found were open for reasons that medicine understands completely. The man whose eyes they were is mourned for reasons that exceed what medicine can address. Both of those things are true simultaneously, and holding them both is the most honest thing we can do with a detail that has generated so much speculation across 15 years. The science closes the mystery, the music keeps the memory alive,